Is a bariatric podcast talking about weight loss surgery. I am not a licensed professional. Any views and or opinions expressed in the show are those of the speakers and do not reflect the bariatric community as a whole. Always reach out to a professional with any medical issues you are experiencing. Thanks so much for tuning in, and I hope you enjoy the show. Hello, everyone, and welcome to another episode of Unzipped with Sherry with yours truly. I'm Sherry. Wanted to say thank you so much again to Kayla last week, who was part of the show, and she gave us some amazing advice. We had such a really good time. For those of you watching right now, you're watching us live on YouTube, Facebook, Twitter, and LinkedIn, I believe. You can also catch other shows on Spotify, Apple, Stitcher, Podbean. Like, we're pretty much going all over the place right now. Like, we're trying to grow as much as possible, and we're trying to get to as many listeners as possible, because I've been so fortunate to just keep meeting amazing people along this bariatric journey. And today, of course, is going to be no exception. And so today we have Ashlyn, who is a licensed clinical social worker out of Florida. And we just connected a few weeks ago, had such an amazing conversation. And so not only is she a professional, but she has the best insight because she herself has gone through this journey and had bariatric surgery. So I am so excited to delve all into it with her. So Ashlyn, I hope you're ready, because we are about to get unzipped. We all have a story on how we got here, right? So for me, I used to be over 350 pounds until one day I made the single decision that I wanted change. Weight loss surgery has saved my life, and now I am here for you. I want to hear your story. You know, the one that happened during that before and after picture. It's time to unzip. What's your story? Hello, beautiful. How are you doing today? And it appears that we were having some slight technical difficulties. So while she is connecting right now, we're just going to go ahead and start the show. So just to kind of give you a little bit of a backstory, one thing that I loved about Ashlyn is she actually messaged me out of the blue a few weeks ago, and she saw that I had a podcast, and she wanted to start putting herself out there and networking more and meeting new people. And she's like, I've actually never done this before, but I thought, hey, this person's page seems kind of cool. Let me see if I can just reach out and put myself out there. And here we are. And now we are connected, and I think she's back. Are you here?
I'm here. I'm like, oh no, right before we start. Don't go out.
I told you, like, sometimes technical things are going to happen. We're going to push through it, and we're going to find a solution, and you are here. Ashlyn, first and foremost, thank you so much for coming today. I really do appreciate it. I'm really excited for today.
Me too. Thank you so much for having me and wanting to talk with me about both my professional, which is usually what people ask about, but also my personal story.
I was going to ask you, like, because you do this more professionally now, do you really have an opportunity often these days to really talk about your personal story?
Not usually. So, kind of, there's different theories on how much, as a therapist, we should self-disclose. Often, if people directly ask me, I'll always, I wouldn't lie to someone, and I would
Right.
tell them, yes, I've had bariatric surgery and had it 10 years ago, and do you have any questions specific now knowing that? But it's not necessarily something I just come out and say, like, hi, my name's Ashlyn. I had bariatric surgery. I'm here to do your evaluation.
Right.
So not very often, and usually more, it's just the general questions: how much did you lose? Did you have any complications? It's not really asking me more about like what actually happened to me, just more
Right.
like stats.
Well, then I am very honored that I get to give you this platform to be on the patient side of bariatric surgery again and kind of put you a little bit in the hot seat. Your story was actually really interesting when we were chatting, so I'm really looking forward for you to share it with everybody who's watching and listening at home. So before we delve into it, why don't you give us a little bit as to what Ashlyn's origin story was before bariatric surgery?
Yeah, so I was generally of average weight until I hit puberty. So there was one summer where I gained like 50 pounds, hadn't really changed much. And that kind of alerted my pediatrician and my mom that like something was wrong. But this was kind of before we tested for things. And so they
Right.
put me on a diet and they said, well, she probably is eating too much or is getting into stuff or eating when you don't know. You need to be a better mom and, lock everything up and make sure she can't get to it. So that kind of started 10 years of dieting. So Weight Watchers, Jenny Craig, LA Weight Loss, the 600 calorie diet where you eat 500 calories of meat and 100 of vegetables, and that kind of started that process. But no one actually figured out the underlying condition that was causing it until somewhere when I was in my 20s. So I had moved to Jacksonville and there was a PCOS clinic there. I eventually got diagnosed with PCOS, and at that time there wasn't really any treatment for it. They just said,
Right.
yeah, you have it, like, good luck. It's going to be really challenging for you. And so I ended up with this PCOS specialist, and he was like, I really want to do a 2-hour glucose test on you, but I want to do it with insulin. He's like, has anyone ever done that before? And I'm like, I don't think so. So he ran it, and he was like, oh my God. He's like, you have the worst insulin I've ever seen of someone who isn't diabetic, even of someone who's diabetic. It's really bad. And I
Really?
don't know what to do with you. So I'm going to discharge you because I can't continue to treat you. It's not safe. And I was like, what? He's like, your
How's the
testosterone's really high, your androgen level, like all the PCOS stuff was just through the roof.
right?
And he was like, I don't really know what to do with you. Um, he's like, you're going to become diabetic, your pancreas will stop working, and then you're going to have to go to the endocrinologist anyway. So I'm going to send you to my personal endocrinologist.
Wait, the
I'm like,
doctor's personal
yes.
endocrinologist.
Yes. So the doctor, and he had self-disclosed. He had an endocrine issue himself, which I kind of thought he might have. And that's how he got into endocrinology. And so he had sent me to his, and that guy was a jerk. He was like, there's nothing I can do for you. When you become diabetic, we'll treat you with some Actose, and that'll probably make you gain weight. So, go on Atkins back then. That's your only hope. And I'm like, well, I've been doing that for 10 years. So it hasn't really
Right.
helped me, obviously. And so I bounced around. I went to another endocrinologist. So this was back before we had the A1 or the GLP-1. So that's like Victoza and Byetta. Those hadn't come out yet, those medications. And so they really didn't know what to do. And in the same time, I became anaphylactically allergic to metformin.
Oh
Um,
my God.
Metformin for years, and all of a sudden I had an anaphylactic reaction, and I didn't believe that was possible. So I took it again, and then had an anaphylactic reaction, which almost killed me. So don't do that.
Yeah, that's usually what I do. If I take something that almost kills me, I'm like, I just want to make sure that it wasn't that
I just
almost
want to
killed me.
make
Like,
sure
let's
it
just
wasn't
do it again.
Yeah, and it was interesting because I had to there's this thing through the FDA where you report rare side effects, and I remember thinking, like, this is ridiculous. I shouldn't
Yeah.
report, like, I don't even know if this is true. And then once it happened, I was like, yeah, I definitely need to report that. Very uncommon, and again, there's no other medication in the category at this point. So I ended up at the Mayo Clinic, lived in Jacksonville, and I saw an endocrinologist there, and their resident had just happened to work at the Cleveland Clinic where they were doing bariatric surgery on average weight individuals who had uncontrollable diabetes. And what they found is that the surgery was really helpful in managing even at an average weight. And so she was like, well, would you consider bariatric surgery? And I was kind of like, do I qualify? So 10 years ago, bariatric surgery was really seen as a last resort,
Yep.
was not a frontline treatment for obesity, and you really had to be kind of at the end of things. And I remember her being like, yeah, you probably do qualify. I was like, oh, okay. So the actual endocrinologist came in and he was like, well, I don't have any better ideas. So
Mhm.
that sounds good. We'll send her over there. And it took about a year because my insurance had uh, heavy qualification for it. So you had to do a whole year program where you're monitored. And so I saw my whole team every month for a year. And then after that, I had bariatric surgery on June 20th of
Mhm.
2012. And I had a gastric bypass. Back then, that was really the only option. My surgeon had stopped doing lap band. He had found that it
Mhm.
was not effective even 10 years ago, which is crazy because that was super popular at the time.
Right.
And sleeve wasn't being used unless it was in conjunction with duodenal switch. Like you weren't safe enough to have duodenal switch, and I wasn't going to be eligible for duodenal switch. So bypass was kind of it at the time.
Yeah.
And so I had that, and it fixed everything. I lost my weight really quickly. Within 3 months, I lost about 100 pounds and was
In
about
three
done.
months?
Yeah, so I'm one
Oh,
of those people that like dropped it all really quickly and then was done. So I stabilized really quickly
wow.
and I dropped the weight really quickly. So might have been 4 months, but by 4 months I was stabilized. So I was kind of done with my losing phase. I maybe lost a couple more pounds here or there, but literally when you fix that insulin issue, it fell off. And it was
That's
really
insane.
interesting to see all of my numbers, all of my endocrine numbers fix so quickly. And then I was permanently discharged because I no longer had PCOS. I think it's six months. So yeah,
That's
no,
and
that was crazy.
And I have to ask, like, going back before the surgery, when you're sitting in the doctor's office and your doctor tells you your numbers are so far off the chart that I can't even help you, and you're like, you are the doctor, you are the one who is supposed to be like helping me right now, and like I just can't, like, what goes through your mind when your doctor's like, I can't help you, I need to send you to my doctor?
I really felt really broken. And I remember thinking, if you can test this high, why don't you know what to do with it? Like,
Right.
if you're seeing, and I think one of the numbers was like in the thousands. And I remember him telling me like this needs to be like 100 or 100. He's like, yours is at like 1,000. He's like that's not functional for your pancreas long term. He's like the only reason that you've managed this long, and he's like, and I know he's like, you must have been dieting and eating so carefully because otherwise your pancreas would have been dead by now. Like you can't
Interesting.
withstand this kind of level of insulin for more than a few years without becoming diabetic.
And because at the time you didn't know that you were diabetic, like, did you have any kind of symptoms or
No,
things
so
leading
the
up?
interesting part is I never actually became diabetic. So my A1C was never it was always in the pre-diabetes because my glucose was okay, but my insulin wasn't, which is why nobody caught it. Because back
Interesting.
then, no one knew how to treat um, insulin resistance anyways. They would have just
Right.
gave you metformin because there wasn't a real understanding that we have now with the GLP-1s that there was anything that we actually could treat people with. And so they weren't even looking for it because what were they going to do with it? So there wasn't they thought that your insulin and your glucose always went together.
Right.
And so if one went way up, the other one should have gone way up, which technically that's what it should do, but it wasn't doing that. And that's what they were trying to figure out. And it's been fascinating for me because I have so many patients who come in who have insulin resistance, like really
Right.
clear signs of it. And they're like, I don't understand. And then I'll kind of explain to them, and they're like, that's a thing. And I'm like, yeah, yeah. And the more you
Yeah.
diet, the worse it gets because your body will just pump out more and more insulin, particularly at night when you don't need it. And it actually goes against kind of dieting. So it'll hold on to more. So like I remember I did the like 500 or 600 calorie diet, the one you get the
Hmm.
B12 shots for and all that. And I remember thinking, this is science. I should
Right.
lose this many, I'm tracking, and I remember thinking like I don't understand scientifically why this isn't working because I'd always hit this magical wall and then never be able to lose more than that. And I remember the one doctor was explaining, he's like, "Oh yeah, no, with insulin numbers like that, he's like, even if you wanted to, he's like, your body's putting all that insulin out. It has nothing to use it on. And so it will store it into fat. And so no matter what you do, he's like, which kind of shows us because you're eating 600 calories a day and
Right.
not losing weight, he's like, you're not going to lose weight. And it's all abdominal. I mean, every doctor I went into, they were like, have you ever been tested for, I'm like, Cushing's disease? I was like, yes. I'm like, I know. Apple on toothpicks. I get it. I'm like, do you want me to do the 24-hour pee in a jug or you want the pill where I go in 2 hours later? Like,
Right.
oh, you've been tested for that? I'm like, every single doctor. I said, I know it's a look. Usually it's a body look, which is why they were identifying that. But I'm like, no, it's just with insulin resistance, you store all your fat in your abdominal area. And so my legs were pretty thin and my arms were
Right.
pretty thin, which just looked funny.
That's so
So
interesting. And it's funny because Jason mentioned that his wife had the same issues with PCOS and insulin. I'm almost curious now. I wish I can kind of go back in time and see if they ever checked that for me. Because for me, the
probably not.
first thought of people is like, oh, your thyroid's off. And I'm like, no, my
Oh
thyroid
yeah.
is, it's all, that's always everybody's assumption is like, it has to be the thyroid. And then you get the thyroid checked and they're like, well, I don't know what to tell you. So, and then that's it. But like, Now I'm curious because I used to have like
Yeah.
the same issue, because I remember doing a juice fast. Juicing was really big at one point, like 10
Yeah.
some odd years ago. I juiced, and it was, and I know that the more fruits you have, like you're not going to get the results, but I was doing kale and chard and a lot of really gross shit, and throwing like some berries or a pineapple, like anti-inflammatory things. After 10 days of strictly juicing, I only lost 1 pound, and I was
Yeah,
well
because
over
I'm sure
three.
that caused your insulin to like, like
Yeah.
through the roof.
And like I had, and I'm like, why is it that everyone else is getting results? And I'm like, and which is just crazy. So you made the decision to have surgery. Like, what was going through your mind when you decided to take the plunge and actually do it?
It was interesting because I remember leaving the doctor's office and calling my mom and just crying. And she was like, "What is wrong? Are you sad about this?" I'm like, "I was just happy someone gave me an option." Because literally up until that point, no one had given me a single option. They were
Right.
literally going to wait for me to become diabetic and then treat it. And I'm like, I don't want that to happen. Like, I know my grandmother died from complications of diabetes. And I will say, she had many other conditions going on, but part of it was she really didn't want to deal with it, and so she
Right.
didn't. And I know that I could have changed, I could have taken care of it, but it's like part of me is like, I'm in my 20s at the time. I don't want to have diabetes for 40, 50, 60
Yeah.
years. And I know what that does to your body because I had worked in some healthcare, and it's like the seeing what diabetes does. It's a cardiovascular disease. People think of it more as with your sugar, but
Mm-hmm.
it's your feet, it's your
Mm-hmm.
kidneys, it's, there's little cardiovascular things in all of your organs, and it's really tough on your body. And so I really wanted to avoid that. At that point, I didn't even care about the weight loss. I just desperately did not want to become
Right.
diabetic, or really be sick anymore. So also having some weird issues with my feet that I found out later was actually, oh, what is it when your uric acid is high?
Like gout.
Gout.
Hmm.
Because from all the low carb dieting.
Right.
But nobody checked it because I was too young. And I remember my doctor, the surgeon, when I came back, he was like, "Are you having issues with your feet?" I was like, "Yeah, it went away." I assumed it was because I like lied down for a couple days after I had my
Right.
surgery. And he was like, "Man," he's like, "You had terrible gout." I was like, "Oh my God." But it went away. I've never had it again. But I was that good at low carb dieting. And that was such
Wow.
the funny thing because my program, so what I've really found is there's some programs that really push low carb, and there's other programs that push kind of like a more balance.
Mm-hmm.
My program was more balanced. So you ate oatmeal, you ate toast, you like crackers, those kind of things. You could have that within your first year. And they really push for like that balance. And that was really hard for me because in my brain, carbs were bad. And so I
Right.
remember the dietitian was like, "Ashlyn, you have to add some carbs in here." She's like, "I know you're exhausted. You have to be. You're not eating like any carbs at all." And even one time I went back and the surgeon's like, "I told you to get off that sauce." And I'm like, "Oh my God, what are you talking about?" And he was like, "The protein drinks." And I'm like, "Oh, I'm not drinking those anymore." He's like, "I know you are." And I was like, "How do you know I am?" He's like, "Your phosphorus is up." He's like, "That's a side effect of the protein." I was like, "Oh, okay." I said, "Well, I still have one, once a day or whatever." He's like, "Get off of them.
Mm-hmm.
Start eating you need to eat food. You need to eat your." But it was so funny because that 600 calorie diet I was on, the Advocare was the kind, or Advant Carb was
Mm-hmm.
the protein shakes. This was before Premier, and that's what you drank every morning with that diet.
Right.
And so I'm like, meh, I was so used to it anyways. But they really wanted you to eat your food, and so, or eat your
Yeah.
protein and get used to eating, and be very normalized in your eating because that's what you need to do for the rest of your life. If you were just going to do low carb, we would have just done that, and that wasn't working for me. So
Right.
it's interesting because I think part of why I was so successful long term was the diet that I was doing post op was far less restrictive than the diet that I was doing pre op.
Interesting. And then I'm curious because if I remember correctly, you didn't really have too many complications or issues post. Like, did you deal with dumping syndrome or vitamin
Yes.
deficiency?
So I definitely, I still to this day, it's only with sugar, and it's only if I'm also kind of at the same time constipated. So the lovely post-op constipation. But
Oh.
if those are kind of together and I have a really nice big meal, like we go out somewhere and then I have a little too much dessert, I get dry heaving, which sucks
Oh,
because
yeah.
it's really loud. So I was in Disney one time. I live in Orlando now. And I'm in like France, the really fancy restaurant in France. And the lady's like, I'm gonna call the paramedic to help. I was like, no, 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 please
Like,
don't
I'm good,
do.
I'm good, I'm good, I'm good, I'm good.
I'm like, I'm good. I know what this is. I'm fine. Nothing's gonna come up because it can't.
Mhm.
Because I can't throw up after surgery, which has been kind of weird. But besides that, the only other thing I've had is I've had a little reactive hypoglycemia,
Mm.
which I kind of had beforehand, minus the reactive part. And the important thing is that other people who are having reactive hypoglycemia. So a lot of times people don't realize it's different than hypoglycemia prior to surgery, where you would
Mhm.
get like a diabetic, you get them juice or something. For us, we really need to have a protein and a complex carb and then weight.
Right.
So the interesting thing is, I know exactly what sets it off. It's the same thing every time. It's eating bread and then waiting too long. So if let's say I'm at this is usually what happens. I'm at
Mm.
a meeting where they catered lunch. Then the meeting goes 3 hours. I haven't eaten anything again. And then my blood sugar kind of falls off a cliff.
Right.
So reactive hypoglycemia is where essentially your blood sugar falls off a cliff. So you'll find yourself in like the 50s or 60s, which is pretty disorienting.
Yeah.
You shouldn't drive or anything like that if your blood sugar's that low. But the funny thing is, the same thing happens so like I can't eat bread. If I'm gonna have a sandwich, I just need to make sure I eat something within an hour,
Yeah.
and then it's not really an issue. But I had that issue growing up. I wasn't a kid who could drink like juice or anything like that. I just always made me puke. Regular Coke, I couldn't drink any of that. So I've
Really?
had kind of somewhat of sensitivity to sugar even as a kid. So chances are that's something to do with it. But as far as um, any other long-term complication, I haven't had any vitamin or mineral deficiencies. Um, I haven't had like obviously if my hair's fine. I got plenty of hair. Um, I've had skin removal surgery, so I did have loose skin. I guess that's a complication of surgery. But
That's not a
um,
complication of, I mean, we're gonna get into that too, but I feel like I remember like when I met with my bariatric surgeon, and I told him, I said, look, I've heard stories like where some people get like really crazy excess skin and like really hangs down, and I was like, what do I do if I have the surgery and I deal with excess skin? What if it doesn't like shrink up? And he goes, well, first of all, that means the surgery was a success and you actually lost the weight for once. And I'm like, well, I'm really glad you put it into that perspective, but see, like, well, one thing that which I'm a hot mess right now because I really want to get into the next topic. Um, One thing that I get very frustrated by is I'm now 8 years post-op and I've literally lost half of myself. And and you can probably relate, when you are over 300 pounds or when you are very obese, you are literally overweight everywhere. Your legs are big, your calves are big, your ankles are big, your arm, like everything about you is big. And then you get to this point where you have this life-changing surgery. You have this energy you've never had in your entire life before. Like you're living your best life. The weight is coming off. But now you have very specific isolated areas that sag and hang. And I feel like they go unnoticed when you're big because, like I said, everything is equally big. But now, when I dance or when I do things, and you can see like your arms just flapping in the wind, and I feel like it almost creates this different kind of an insecurity because you feel like people are now fixated on one part of your body, like the thighs that are hanging down in the shorts. So I'm curious for you, like, what made you decide to want to have it removed? Like, did it get to the point where it really bothered you, or was it more like medically needed?
Probably a little bit of both. So I will say my arms were one that like I couldn't. I felt like in pictures that was one
Mm.
area that you knew that I was previously obese.
Yeah.
Like there was something off about them, and it wasn't that it was my armpit area. It just looked off. Like
Hmm.
when you looked at it, you're like, that doesn't quite look right, but I don't know what's wrong with it.
Right.
And so that was kind of hard, especially people that maybe knew me only in a smaller body, where they're kind of like, oh, you used to be, oh, yeah, 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 I could see you're in arms. And I'm like, oh, that would be like a common
Hmm.
thing people say. I was like, oh. But I think that for like I had a pandectomy, and like that really impacted being able to work out and exercise, having like skin issues.
Yeah.
So that I did that first, and then my arms and back, I got an upper back lift. So genetically, my entire family is very thin, but genetically, we like to carry weight in our upper backs, which is like a
Why not?
really weird, yeah, place to
Sounds
carry
fun.
weight.
Yeah.
Yeah, so it made it really hard to like wear a bra or
Mhm.
t-shirts. And so that was something that I felt was, though for me, but also was just part of like trying to feel normal.
Yeah.
Being able to like buy a normal bra, buy normal t-shirts. Same thing I remember when I had my pandectomy, and like pajama pants never fit right.
Right.
And that was such a weird thing to like be able to wear like a t-shirt and pajama pants. And I was like, oh, I look kind of
Mhm.
normal. Um, so that's kind of a mixture of both. And it is kind of hard. I have a lot of people come in, and they're like, I just want to be okay with it. And it's like, it's okay if
Right.
you're not okay with it. Like you can be accepting of where you are and still not like like opposites can be true at the same time, and
Right.
that's okay.
It's so funny. Like something you just said, I feel like it's just like this light bulb just like went off, and it really struck a chord. When you said that you take certain pictures and like your arms were like this proof that you had surgery. And I was like, "Oh my god, I think like for me personally, I've always struggled even for the last 8 years with confidence, with self-esteem, with the idea of trying to exude sexiness in any way. Like I am extremely awkward, like that's not me." And people are like, "Well, where things like they've been trying to give me like tips on like what to do." And all of a sudden like you said that and I just heard like this ding 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 because recently I was at a gala. I was at my first gala. It was very fancy and I had to wear this fancy dress. And it was this gorgeous dress. And with women, we got Spanx on our side, so you can wear certain things. And looking in the mirror, and I for the first time, I saw like this hourglass figure that I've always envisioned. And I was like, I literally feel like I'm the best version of myself. And I looking at the pictures, like I think I put my arm up or whatever, and it was hanging down so much that was all I could see. And I was
Yeah.
like, somebody who had my arms not been like that, somebody could have looked at me and never known that I was ever 350 pounds. But I feel like it's now kind of in this place where this stigma of your past is still with you because no matter how good I look in a dress or in pants or I feel, there's still this evidence of where I used to be. And I think like, dude, you just like mind blown me right now. It's freaking
Well,
crazy.
it's interesting too because I've always had a very, very boxy shape. That's a
Mhm.
PCOS thing. And so like no hip, no difference between waist to hip. I'm very,
Right.
very boxy, not particularly like no butt. So I always had a really hard time with pants. And I remember like I just wanted to buy a pair of jeans. And I
Right.
remember my surgeon was like, what kind of body, if you, and I'm like, well, that's an interesting case. And I said, Ice-T's girlfriend Coco. Do you know who I'm talking about?
I know who
And
Coco
he
is. Yeah.
looked at me and he was like, honey, we ain't ever gonna get. He's like, no amount of. I'm like, no, no, no. You just asked me. What he was like, well, what do you like? I was like, she just looks so feminine. Like I just want to look feminine. Like that was always her.
Yes.
Like men's pants usually fit, but they were like the word. I was like, I don't want to wear men's pants forever. Like I would
Right.
like to have some kind of like there's
Shape.
a change. Yeah. And
Yes.
so he goes, okay, well, I can work on feminine. He's like, but you ain't never gonna. I'm like, no, no, I know.
You're like, I get.
But it was good, to be able to verbalize what it was. Like, I think that is what I just wanted to look more feminine because I had such
Mhm.
a masculine body type.
Right. That makes. And so I'm curious when you had I'm not even going to pronounce it right. The tummy tuck, the panda is what I call it.
And ectomane, yeah.
Yes. What was the recovery like compared to the gastric bypass?
Here's the interest. So the difference between a pandectomy and a tummy tuck is that a pandectomy has no muscle repair. It's
Okay.
literally just the skin, and so the recovery is nothing.
Oh,
Um,
really? Okay.
when people have tummy tucks and they have muscle repair, that's what really kicks people's
Okay.
butts. So that muscle repair is pretty painful because we're literally like sewing the muscle back to the abdominal wall.
Right.
But in a pandectomy, like honestly most of my skin surgeries. Now, I also have a really high pain tolerance, but
Mm.
you're not going that far down. It's kind of a weird concept to think of, like when you remove skin, it's like
Yeah.
you're you're essentially making kind of a giant cut and then like sewing it back together, but you're not actually like interacting with stuff below that. And it's kind of weird to explain. So I had a little harder time with my arms and back because the scar line was so like
Hmm.
being able to kind of like move around. I didn't have any, I'm a super healer as well, which is a nice combination.
Nice.
So I never had any kind of anything bust open or anything. But my surgeon was also kind of neurotic about like how many inches of scar line he would do at a time, which was kind of weird because I've
Hmm.
never talked to a plastic surgeon that has any rules like that. But his feeling was he didn't want anything to bust open essentially. And so
I would
he
hope
had
so.
kind of because I wanted him to do the extended to like go down and then pull
Oh,
some
yeah,
of
yeah.
the skin like here, but
Yeah.
that went beyond kind of what his like whatever his magic number was for that, which was fine. Um, but I think that yeah, so most of it was to kind of feel normal, but also again kind of maybe have the body that I never had because of
Right.
PCOS. Because the hormonal, because like I remember one of the doctors, maybe around 18 or 19, they were like, you have the testosterone of a 17-year-old boy. So like be careful. And I was like,
What does
what?
that
And he
mean?
was like, he's like, are you having any issues with like rage? Or and I was like, no, no, nothing like that. He's like, okay. But I had it's interesting. I was in I know we're like jumping all over the place, but
No,
I
no,
was
you're
in
fine.
um rowing crew, like rowing.
Yeah,
And
yeah.
I remember there was a group that had some concerns that there was like something going. They never came out and said it, but I think either they were suggesting maybe I was a man at one time or I was taking steroid. I mean, I'm sure they're just being cruel, but
Right.
I do remember thinking like if they tested me right now, I would show up that my testosterone's really high.
Right.
So I don't know what I would do to like, I guess the doctor would just say that's normal for me. But I mean, I could like I could bench press a lot. I could like
Yeah.
all of the benefits of having all that. That was a weird transition for me. When I lost all the weight, I no longer had the strength that I once had. So like I worked in sports bars and stuff as a
Hmm.
cook, and that's a funny story. And I could like pick up kegs, move them around,
Yeah.
like nobody. And I remember there's this guy I worked with. He'd never seen me do that. I like picked it up. He's like, "Is that empty?" And I was like, "Oh no, it's full. I'm bringing it, into the cooler or
Yeah.
whatever." He was like, "You just picked up a keg, a full keg, like it was nothing." I was like, "Yeah."
Yeah, why not?
And he was like, "All right,"
Which
but
that's so fascinating because I feel like you're my spirit animal right now. Because when I was younger, I mean, I was I tell people I was a total tomboy. We didn't have girls in the neighborhood; it was just me and a bunch of dudes. But when I was young, I was actually very strong. I was able to hit the ball harder than most of the boys. I could throw the ball further. Like I was very, very active. But not only that, you just gave me like this flashback. My mom used to call me Butch when I was a kid because like we would have to move something and she's like, oh, we'll just wait for your stepdad to get home or we'll wait till your brother gets home. And I'm like, no, I got this. And I just like pick it up and I like move it into the next room. And she goes, okay, Butch, like you don't need to be doing that. But it just felt so natural. I was like, it
yeah,
didn't feel like
like
it. I
why
mean,
wouldn't you?
yeah, it did. I mean, yes, it's heavy, but it wasn't like beyond my capabilities. But what's funny is I noticed that as I got old, well, getting older too, but when I lost all the weight, I still had physical strength, but it's funny, I don't think it was nearly as much as it was when I was
No, I
younger.
certainly can't bench press what I used to be able
No, I
to, which
can't.
is fine. I have no desire to ever bench press that much again, but
Right.
it's just a weird because I did powerlifting for a while, which is like super fun. If you ever want to get some like emotional stuff out,
Oh my god, I
power.
can the quick blurb is my husband used to be almost 400 pounds at one point, and he ended up starting going to the gym and cutting everything out of his diet, and he's lost like over 150 pounds on his own. And he ended up, when we moved, he joined a powerlifting gym, not because it was powerlifting, it was just like this local gym that happened to do powerlifting. And he just did his first competition a few weeks ago and he just signed up. I think he caught the bug because now he's in the middle of training for number two, which I think is like in a week and a half. And he keeps trying to get me to do it. I'm like, no, like I'm good. Like I watch these people and like I'm off on a tangent right now, but he came home the other day and I'm like, what's on your leg? It almost looked like a bump, like he had gotten like a bug bite. And he looked down, he started laughing. He goes, babe, that's called veins. He's like, my veins are popping. It was leg day today. And I'm like, yeah, I don't want that. So yeah, I'm not, if that comes from
Put that
powerlifting,
away.
yeah, you put that shit away. I don't need the shit right now. Like, it's just so funny. So you've had multiple plastic loose skin procedures. You had the stomach done, you had the back done, and then
And
the
my arms.
arms.
Yep. And I had some fat transferred around, not very successfully, because that was kind of before you could do like Brazilian butt. Like that wasn't like a thing when I had it
Right.
done. But they moved some just so I had a little more to like hold pants up because
Okay.
essentially there was like no shelf kind of where your pants should go. It just kind of like it just kind
Right.
of went away.
Going down.
So they added a little there. It never looked quite right. He definitely wasn't not his fault. It just
Right.
that wasn't like a thing back then. Um, so I did a lot of Pilates and that kind of helped.
Kind of help like smooth it out. So how much of a game changer was it for you after you got your arms done? In the sense of like, I guess like confidence or just daily.
Yeah, I mean it still took a while. I think it still took many, many, many years. Like I didn't wear
Really?
shorts until maybe like 2, 3 years ago, and not even regularly. It took a long time. It's funny, I have some pictures of like when I went on my honeymoon. I wore a bikini like for the first time in public.
Mm-hmm.
So I had surgery in 2012. I got married in 14, and I think 14-ish was when, yeah, October, we went on our honeymoon. And there's some pictures, and I just look like, oh, don't look at me. And then I
Right.
was just on vacation a couple months ago, and in the same bikini, on actually in the same place, which I didn't realize. And I took an after photo and it was funny because when I was looking at the photo, I'm heavier in the one now,
Mm-hmm.
but I don't look it because I look more confident.
Interesting.
I did a very good job of not being in pictures. I have very, very, very few before photos. The one that I used in the opening was one before I had surgery, my husband and I, and his parents, who I adore, we went on a cruise together.
Mm-hmm.
And I purposely was like, okay, I have to take some photos because if I don't, I won't have any from before.
Right.
This is before like phones having like they kind of had cameras, but they weren't great. So we actually like bought a camera
Mm-hmm.
and we brought it on vacation and we took some photos for the purpose of, but they're all kind of awkward. Because I was usually the one who would take it or be like,
Mm-hmm.
oh, I gotta run these ladies. Or like, I'm not gonna be in this photo.
Yeah.
There's this one photo I saw that it's a bunch of friends. We're all sitting on this couch and it's this kind of crappy couch. So we're like way in it, but it looks terrible. And I remember thinking, is that what I look like? Because it's interesting. I kind of had reverse body dysphoria.
That was me
So
too.
I never realized the size that I got to. And so when I was online dating, I probably was putting on these photos that like were not the best represent, but that's what I thought I looked.
Right. It wasn't that
I
you were
remember
trying to catfish, you just genuinely
No,
didn't
I
see it.
I just, they're very specific angles, very
Yeah.
specific, and I just was like, "Well, that's what I look like." But really didn't I didn't have mirrors in my house,
Right.
especially not full length. I had obviously like one in the bathroom, but you can only kind of see here up. Um, I was really, really busy. I was in like working full time in grad school full time. So I mean, I hadn't even when after I got out of school, I was working for the health department full time. So I mean, I was just living my life. I wasn't, taking
Right.
pictures or anything. And, we were poor, so we had no money to go on
Right.
vacation, but it really took a long time of getting used to taking photos, purposefully taking photos. Um, like it's funny, I was just in Costa Rica with some friends and I was like, oh, okay, can you take some photos of me? I'm gonna, go by the beach. And and be okay with that. Because
Mhm.
I think I always had this fear of looking, oh, what's the word? Like full of myself or
Right.
that
Conceited or
if
something.
yeah, yeah, or stuck up or showing off, that kind of thing.
Yeah.
So for many, many years, I didn't take many photos, even after I had surgery, even after I had the plastic surgery or skin removal. Um, Probably only in the past couple years, I've just been like, screw it. I'm going to take photos. I'm going to acknowledge the hard work I've done. I'm going to acknowledge that
Right.
I'm here and I'm having fun, and that's okay. And I want to have pictures of my husband and I. We love to go to Sandals, and part of what you get at Sandals, like every time you go, is you get like a free photo session, and that's like my
Oh,
favorite. And they'll find you like at the beach, and I'm like, okay, honey, you know the rule. Hair doesn't get wet until the photographer comes.
that's
So the
so funny.
photographer comes around. I'm like, okay, good, now I can get my hair wet. But that's something. And then at the end of the vacation, we go through all our photos. We pick the
Yeah.
ones we like, and we buy them, and then we have a special one that we like put on the wall. And it's like, that's okay. Like, that doesn't mean I'm full
Mhm.
of myself. That means I worked
No.
hard, and, I want to have, my father-in-law passed away, and there's no photo of,
Mm.
my husband has one brother who's married, but there's no photo of the six of us. And that's so upsetting to me. Because we don't have that like
Yeah.
family photo on that side. And part of that was like, I just didn't want to be in photos. I took photos where I'm out of it and I'm taking a picture of everybody
Mhm.
else. And even at our wedding, for whatever reason, I guess my sister-in-law wasn't in any of the family photos. But that's one of those things. I don't want that again. So I'm
Right.
usually the one like a couple weeks I'm going up to up north for some like fall stuff. And I'm like, okay, like let's see if we can get a photographer to come and take pictures of everyone. And I because I want to have those kind of like
Right.
memories.
Isn't that
Um
isn't that funny though? Like I feel like you're giving me all these aha moments. That makes a lot of sense as to why you didn't always see yourself as bigger. Because I was the exact same way. I never realized how big I was until a picture came along. But we live in a day and age where you take a quick selfie, like with a group of friends. You're like, no, no, I don't like that one. I look fat. I have two chins in that one. Like, let's do it again. We didn't have that option back then. Back then, we had maybe a disposable camera. You still had to
yeah.
wait a couple weeks to get them developed, and then you like get all these pictures developed, and there might be two good pictures, and one of them's fuzzy, and the other one you look like like a beached whale, and you're like, wait, that's what I look like, because you're not registering it. And the biggest for me was I was the same way. I never realized how big I was because I thought I could still do stuff. I can still lift heavy things. I can still be somewhat active. But it's not until you're sitting somewhere and you happen to see a reflection off a window in a restaurant with you
Yeah.
hunched over the table and you're like, oh my God, that's me. Like you don't see it. And I
Yep.
think it
I
has a
definitely
lot.
have pictures where I'm like, who's that person?
Yeah.
Like,
And you're like, oh shit,
oh,
that's, oh.
that's me.
Yeah.
And that happened a lot after
Hmm.
surgery. It took a really long time, which just makes sense. We don't walk around looking at ourselves, but it
Right.
took me a really long time to see myself as I am now, and even true right now. I, and it's been interesting during the telehealth because you stare, your little pictures there, so we end
Yeah.
up staring at ourselves all the time. But it is an interesting phenomenon, having to forever kind of, okay, this is what I look like right now, because we are forever changing as we age and
Right.
other things. But um, that was a process for me after surgery. Like, what do I look like now? Especially because I lost my weight really quickly. So like that, it wasn't like a gradual thing. It was just like,
Right.
again, it just kind of fell off a cliff. So that was really tough at times. I struggled. This is actually something that happened that I didn't talk about. I had a lot of upper back pain, and it took me a long
Really?
time. I finally found this great physical therapist, and he was like, Ashlyn, I figured out how to explain this to you, but it may be offensive. I'm like, oh, this is good, honey.
Bring me
Tell me
offensive.
what you got that you think is gonna offend me. He goes,
Give it to
okay.
me.
He's like, sausage? I was like, yeah. He's like, not cooked. I was like, uh-huh. And he's like, squish the middle part. I was like, uh-huh. He's like, what would happen? He's like, top part falls over. He's like, the fat you used to have in your abdominal was holding up your shoulders. So you
Really?
never developed any muscle in the scapular, like the top part, because you never needed to. He's like, you lost all the weight and now your shoulders have nothing holding them up. So I had to do a lot of physical therapy, to get that like back up to where, but that was one thing that I gone to different doctors and they're like, yeah, you're fine. Everything looks fine. And finally that one physical therapist, and I was like, oh, so that was part of that like transformation. That's what made me think of that. It's like, kind of,
Interesting.
what is my body now, but also like
Right.
what are some of the limitations, or I thought I'd lose weight and all of a sudden I'd be like running marathons. And I remember my orthopedic doctor, he was like, ain't nobody running a marathon with that knee of yours. He's like, you had your knee partially replaced at like 17. You think you're gonna run a marathon? I was like,
Right.
oh, I can't run a marathon. He's like, I don't even think you should run a 5K. I was like, oh, really? He's like, no. He's like, what in your knee? He's like, first off, he's like, you're not running evenly.
Right.
He's like, so pick something else. Can't you pick another goal? I was like, oh, but I always wanted to run. And he was like, no, pick
Oh.
something else. I'm like, okay. Because that was one of those things after I was like, I'm going to run that
Yeah.
5K. I'm going to run a half marathon. And then I kept having all these like hip and knee. And the orthopedic was like,
No,
Ashlyn,
and
why didn't you come and ask me this before you tried to do this? I'm like, because it never occurred to
yeah.
me you'd say no.
I didn't think, and that's so funny because people who've been watching the show or know me personally, like my back went out for over a month. And you lose all of this weight and you think that you're unstoppable and you start doing
Yeah.
things that you've never done before. And it doesn't occur to you, like, keep in mind, you've damaged your body for 20, 30 years. It's not going to go away overnight. And I'll be damned if that stripper pole didn't try to kill me, because it was trying to do the pole dancing class that had completely, I think, was the catalyst that triggered this entire
I
experience.
I only laugh because I had a very similar. I have a friend of mine who's like expert level, and she was like, "Come over to my house," and I was like,
Yeah,
"Yeah." Oh my God. First off, I have no fear. I don't realize this. So she'd show me something. I was like, yeah. And I would like do
let's
it.
do
She's
it.
like, oh my God, you just went for, I was like, yeah. And she's like, you have no fear. But oh my God, the next day I could barely walk.
It's terrible. And I realize, which goes back to what we were saying, I used to have a lot of upper body strength when I was a kid. I have none now. Like
Yeah.
I couldn't hold myself. So when you take the pole dancing class, they gave me like the silks, and like
Hmm.
and you can hang, and so I hung upside down and I have this amazing picture on Instagram. I look freaking hot as shit. Like I loved it. Like the angle, my legs are all out and I felt all like amazing. But in hindsight, looking back now, that thing sits right on your tailbone. And when you're in that position, all of your weight is now isolated to that tailbone area. Well, I've had trauma to my tailbone, like falling when I was a kid, and then
Yeah.
add 300 pounds on top of that and never like healing it properly. I think
And
that
that's
would,
something even now, I cannot sit in chairs that don't have pads.
mm-hmm,
Like, if I
it's
go to a
uncomfortable.
restaurant with, like, a wooden booth, my husband knows. He's like, "Oh, no, she can't. She can't.
Yeah.
She can't sit on that." Like, I had such tailbone pain. Super common post-bariatric, again, just has to do with, like, loss of fat there, but
Mm-hmm.
also, it's like, even if you didn't damage your body is used to it being a certain way, and when you rapidly
Right.
change it, it needs time to adjust to that, and so, sometimes it also needs help with, like, muscle development,
Mm-hmm.
because again, center of gravity, especially if you hold your weight abdominally, you're tilted forward, which
Yep.
tilts your pelvis forward, which then when you go back, it then realigns your hips, your pelvis. So that also impacts lower back
Mm-hmm.
because your body's essentially trying to readjust to where your center of gravity is.
Yeah. And then it's,
Particularly true with men
mm-hmm.
who have maybe carry a lot of their weight in their belly. They tend to have a lot of pelvic stuff post surgery that physical therapy can help with. But it's really interesting. We don't really think about those kind of things
You
post
don't.
bariatric.
You don't. Like my husband was literally just telling me literally last night, because I was talking about my back and I was like, I just want it to be better already. And he was saying that he's like, I'm gonna tell you something that I feel like if I told you in the past, you would have been offended by it, but I feel like you can handle it now. And I'm like, I love conversations that start off like that. Like, let's go. Um, but he said when I was really heavy, I used to sit on my back and not my butt. And I was like, what does that even mean? Like, how do you physically sit on your back? And he was explaining to me how I used to get in and out of a car. And I guess I must have slid through my lower back and I must have been
Yeah.
sitting more on the lower back. And I was like, I almost wondered if it was because my ass was so big, because there was so much fat, that it was like the way that your fat moved around in the chair. And I feel like you don't realize how much pain you're in until, because you're not consciously aware of how much you are adapting your body to move around it, instead of learning the proper ways to sit and to maneuver. And I was like, I think for so many years I was overcompensating one area with another, not realizing it. And then all of this weight goes away, but you're so used to sitting a certain way or doing things a certain way that it's just a habit that causes
Yeah.
even more problems down the road.
It,
Like, I mean,
it's funny too, you said the thing about getting out of the car. I always had to have like, I had one car that was so uncomfortable that after I
mm-hmm,
had that car, I always had SUVs because they were just easier to get in and
mm-hmm,
out of. Um, But I remember thinking, I am not too fat for a car. Like, this is ridiculous. Like,
Yeah.
people much heavier than me have cars.
Mhm.
They can get in and out of cars.
Mhm.
But I remember one time, it's like I did something and I was just like, this is ridiculous.
Yeah. It's in like, so after I had my surgery, my car right now is a Mustang because I was obsessed with Mustangs when I was a kid. And Mustangs are bucket seats. And I'm like, but you know what? I'm not 300 pounds anymore. I can get in and out of that bucket seat. And people would complain, don't care. This is my car. We can take your car if you want. Well, you second guess all of your life's decisions when your back goes out because you're like, all of a sudden I can't get in and out of this car anymore. Like, this is ridiculous. But okay, so I talk about this every week. We are almost running out of time, which I can't even believe we only have about 10 minutes left. So I do want to get into the second part of your journey, which is that you
Oh, yeah.
decided that not only did you want to, better yourself and better your life, but you've now been inspired to wanting to help other people. So can you give us a little backstory on how we got here today and what you're doing now?
Yeah, so I had already been a therapist at that before I had surgery. So I just was not working in bariatrics. And I made a conscious decision not to work in bariatrics for a couple years because I just wanted to make sure I had all my own stuff worked out.
Right.
And I wanted to be able to, especially if I had any kind of negative experience, not bring that in with me. I didn't have a negative experience, so that ended up being good. And I started doing pre-surgical evaluations just as a means to make one of the first groups I worked with, we got kind of paid. Our pay structure was a little different, so um, I got paid more to do the evals because they charged more for them. So that's kind of I started doing some of the pre-surgical evaluations. That was mostly focusing on getting people ready for surgery, and I just did a sprinkling of them here or there. And then a couple years ago, I started doing that full time. So I do pre-surgical evaluations for readiness for surgery. I train other providers to do pre-surgical evaluations from a
Mhm.
bariatric patient perspective, making sure that we are not gatekeepers. We're not forcing people into treatment that don't need it. People still have body autonomy and can choose or
Mhm.
make their own choices. That's a very different outlook than some
Right.
therapists have. So I try to train other therapists from that lens and perspective that we're optimizing patients for surgery. We are not like pass failing anybody. It is not saying you need to deal with this before you can do that, but also educating on them. It's really would probably benefit you to work on this
Mhm.
before you do that, or in the meantime while we're getting the rest of your clearances, but really for people to have buy-in for their own treatment. There's not a lot of areas in therapy that we force people into treatment,
Right.
and it doesn't usually go very well when we do. It's usually like legal or has more consequence. So to me, I really want to have a lens of I want to educate. I want you to be prepared as you can, though it's really hard to be prepared. And that that's more the perspective. And so I do that full time now. Advanced bariatric counseling is my counseling private practice, and then learn bariatric psychological assessments is the training, and bariatric therapist or bariatric patients as therapists is the group where I do training, and then eventually I hope to do retreats for bariatric patients who are also therapists working in bariatrics. So we're kind of a small group, but we're out there, and so that's the ASMBS, the American Society of Metabolic and Bariatric Surgery, does a wonderful job of not gatekeeping providers. So they don't have like a certification that says only these people can do
Mm.
evaluations or ongoing therapy. But unfortunately, at the same time, that makes it really hard to figure out what to do. And so I came up with education and all that in that training. So that's been really nice to go to the ASMBS conference every year. I'm a member with them. I actually have a booth this year, which is going to be kind of
Oh,
fun in
nice.
Vegas for the training. But that's been kind of an interesting intersection. So I work with clients who are struggling. I work with clients who are doing really well. But one of the things that I have to be careful of, and this was some of the thought process I had too, is that I am not the norm for outcome. Less than
Hmm.
3% of people will be at 100% excess weight loss at a 10-year follow up. So I have to make sure that I'm
Really?
setting realistic, yeah, it's really low. because we never expected you to lose 100% of your excess weight to begin with. So
Right.
when you go to the ASMBS conference, when we talk about successful weight loss, we're talking about 65, 75, maybe 80 with duodenal switch, but
Right.
no expectation that anybody was going to lose 100% of their excess weight. And so that's one of the big things when I talk to pre-surgical clients, is making sure that they have realistic expectation for weight loss. Like,
Yeah.
we don't expect them to lose 100% of their weight, even from the get-go. And
Right.
so don't avoid post-op treatment, which is what happens so often when people have regained. They're not having any follow-up. So people are walking
Mhm.
around 5, 10 years post-op. They've never seen their doctor ever again. They've never had
Right.
vitamins, blood work for their vitamins, especially the weird ones that nobody tests for. That's really, really, really problematic. So,
Mhm.
it's one of the things that, yeah, and Jason, it is true. 100%
Mhm.
excess weight is extremely rare. It is. And so I have to be, part of my concern was that, am I setting people up to identify themselves as
Right.
failure when they see me, to believe that that's exactly what's going to happen for them? And so I spent a lot of time and energy, but also because I really don't want people to identify themselves as failures when we never had the expectation that we would do
Right.
that to begin with. And so I want you to come back and see me, but I also don't want you to be in fear to come back and see me because you think I'm going to think you're a failure. Well,
Right.
she figured it out. Why can't I? And it's tough. I mean, I've had one of the things when I was in the process for surgery, I worked for the health department, and I worked with really high risk psychosocial moms that were pregnant or having babies. And I remember this one mom, she's pregnant. She looked at me and she's like, "You're gonna come here in my house and tell me how to raise these babies? You don't look like you've taken care of yourself a day in your life." And I
Oh,
was like,
okay.
that's probably true. And then I had another client that I was doing a bariatric eval in the beginning, and she goes, "What the hell do you even know about this? Doesn't look like you've had a fat day in your life." And I remember thinking, like, "Oh man, I can't win here. I
Yeah.
can't win here." And then I told her, I said, I had this surgery, and that's probably why you think that. And, we had a conversation about it, but it really is tough when, you don't want to set unrealistic expectations,
Right.
but you do want people to know this is possible, but it's less than 3% at a 10-year follow-up. So,
Which that's so sad. And I'm
yeah.
I'm hopeful because I just hit the 8-year mark. I feel like I had like we all it happens to all of us. Like I've had regain in the past, and
Oh yeah, I have to.
it took me 4 to 5 years to get the weight that I got off. And this is the first time in my life that I feel like it's not just a fad. It's not like a little kick or whatever like this. We're in it for the long haul. So I'm confident, knock on wood, when we hit the 10 mark, I want to be part of that, 3%. Um, but before we go, if somebody's watching this right now who is getting ready for their surgery or is on the fence or is thinking about, is weight loss surgery for me, or comes to you and says, what would be some advice that you can give me to prepare for surgery?
My biggest piece of advice is work on your relationship with food, and it's not what you think it is. So a lot
Interesting.
of times people are like, "I have to accept that I'm never gonna eat cake again." I'm like, "Honey, you're gonna eat cake. I just had a
Mm.
donut the other day." Like, you will eat all the things. You'll have
Yeah.
pizza again because they're like, "Oh, the nutritionist said I'm never gonna have this or that again." And I was like, "Well, that's no way to live." You need to focus on how food makes you feel versus how, if it's good or bad. So
Right.
if you eat sugar and it causes you to dump, and you continue to do that, we need to examine that. Because are you purposefully doing that to harm yourself? Is that a form of self harm? But if you eat sugar and it doesn't make you feel bad, it's okay. Like,
Right.
do we want to look at the quantity, how often, and we want to look at nutritional denseness of it. So, is the majority of what you're eating nutritionally dense? Are you getting, nutrition from the food that you're eating? But yeah, sometimes you're going to eat cake and you're going to eat pizza. But if you beat yourself up when you do, when you feel like that's falling off the wagon, when you
Mm.
identify yourself as a failure, that continues those patterns of
Right.
behavior. So, food is food is food. It's not good, it's not bad, it's food. So if you're using it to self-punish, if you're using it to reward, if you're using it, as I only get to do this when I only get to eat the pizza because I went to the gym for 2 hours. It's like, hell no. Like,
Right.
we didn't have this surgery to obsess over food for the rest of our lives. We had this surgery so that we could live the rest of our lives with
Yes.
food. And so I always tell people, like, sometimes, we were talking about this right before. It's like, I had someone, they're like, man, Ashlyn, I've fallen off the wagon. I'm like, all right, what happened? They're like, I ate 3 mini Kit Kats. And I'm like, I don't even think that is 100 calories. And I think there's some protein in that. They're like, really? I was like, yeah. Like, maybe don't eat the whole bag.
Right.
That might be problematic. But here's what happens when you deprive yourself, then you eat the whole bag.
Right.
But if I say I'm going to have 3, we're going to portion it out. We're going to be realistic about it. We're not going to eat it all day, every day. But, and the other one too is, it's not cheats, it's treats. We can have treats, but we don't have them all the time.
Right.
But we don't cheat. Nothing is cheating. It's food. Food is
Right.
food is food, right? It's not cheating. But if I know on Friday, I'm going out with my family and we're going to a restaurant that I love and I need some calories. I need some extra calories because I'm going to eat what I want. So the rest of my day is going to look pretty good versus before where I'd say, fuck it. I'm going to, we'll hit up Burger King for breakfast. Oh, they're going to Taco Bell. Let's hit up
Right.
Taco Bell. It's Friday. It's cheat day all day. Like, I could potentially eat thousands of calories that
Right.
way versus I brought my, I made breakfast at home. I brought my snacks. I prepped my lunch. I knew the rest of my day was looking pretty good because I know tonight I'm gonna
Right.
eat some good food. And that's how I want to live my life. I don't want to live my life going where I have to count every morsel of food. So what I do for tracking, and this is kind of good too for people who are kind of far out, once a week I track for a day. Or once a month I'll track for a day because the idea is, do I think what I'm eating is actually around the calorie, and really I don't care about
Right.
calories, I care about protein, that I think it is.
Right.
And so I'm using tracking as a form of data versus punishment or restriction.
Right.
So sometimes people are like, well, I can't go out with my friends anymore because I don't know the exact grams. Or I had a client that was bringing a kitchen scale with her everywhere. I was like, cut that shit out. Like, you can't go to Chipotle and like hand them your kitchen scale and be like, I need about
Shit, I
50
can.
grams of, right. She probably was. So again, it's like, you can't live like that.
Right.
So we're using that as data. I remember Chipotle, that's a good example. I always ordered the burrito and then I'd never eat it. And I'm like, why am I ordering this? Because it's what
Right.
I've always done. But really
Yeah.
what I want are tacos. But I
Yeah.
don't particularly want the taco. So I want the rice and the beans and I want all the stuff that used to be in the burrito, but I want this much of it.
Right.
So now I order 2 tacos and have them put all the stuff I want in it and just eat the inside of that because that's what I really want. It's not deprivation. I'm not saying you can only have the tacos. But it's one of those things is I wanted to use tracking more as data. Is what I think I'm eating. Do I really want to spend that much calories on that? Like, wouldn't I rather have this other thing? And that way it's that data entry. So
Mhm.
don't track every day. Don't weigh yourself every day. If it causes you any kind of distress, don't do it.
Right.
You probably do want to weigh yourself every once in a while, just kind of see where you're at. But it doesn't have to be daily. Do it daily when it's fun in the beginning. Don't compare yourself to, don't get on the Facebook pages and say, Ashlyn, look, this person lost 90 pounds. I'm like,
Right.
yes, but their starting weight was double yours. Of course they
Everybody's
lost, or they had a
different.
different type of surgery that we expect
Yeah.
faster weight loss for. So comparison is the thief of joy, like for real, for real. Like, don't compare yourself. Everyone's journey is different. Everyone's, you're going to plateau. That's totally normal. You may lose your weight all at once. You may lose it for a longer period of time. You may need to add medication. That's a big one. Some people feel like if they add medication, they've failed.
Right.
Well, guess what? Sometimes we need to I've had to put medication on board at certain times, and that's okay. Again, this is your health. This is not that you
Right.
failed. It's that their body, particularly for some types of surgery. So sleep surgery doesn't always do a lot of intervention with GLP-1, which for a lot of people, myself included, is kind of the biggest indicator for my obesity is connected with that. So sometimes we need to put that GLP-1 medication on board to help with that. It's not
Right.
that the surgery failed you. It's just that we didn't intervene at the point at which obesity is incredibly, incredibly complicated. It is
Yes.
not just one thing. And we are learning one of the things that they said at the AS, this blew my mind. We have no idea what it means, but this is what we figured out. So we did all like a couple hundred people had bariatric surgery, all different kinds. And we tested their gut biome in the beginning, and then we tested their gut biome at a year, and we looked at like who was the most successful. If your gut biome changed, you lost more weight.
Really?
We have no idea what it means. We don't know what it's changing. We don't
just
know
why. It means something. We just don't know what it means.
We just it like correlated, and they're just like, so does that mean we need to do like gut biome transplants instead? It's just really, really fascinating, because that's hormones, that's gut biome, it's how your body metabolizes things, it's how your body stores fluid.
Right.
Some people just store a lot of fluid, and that can really, make your weight go up and down.
This is all so fascinating.
So fascinating. So fascinating.
I would love
again,
to. Oh, go ahead.
No, go ahead.
I would say I would love to have you come back and talk about the like the gut flora and everything like that. You and I had talked about that before the show. We didn't even get to it today, and we're not going to have.
Yeah, I don't know if we could talk specifically about that, since I'm not a scientist, but we could definitely talk more about kind of like obesity and how complicated it is, and like all the mental health aspects of it too, like what we're told. I think that's a big thing, like this myth that it's just willpower, like you just need to eat less calories and move more. I'm like, there was one point where I was burning over 1,000 calories with working out, because I was doing some crazy workouts, and only eating 600 calories. So like deficit out the wazoo. Right. And I wasn't losing weight. I'm like, this can't be possible. Like, what is, and it's because it's all these other things that we kind of don't understand. That's really involved in obesity, that isn't just calories and exercise. And I know we've gone over our hour. I could talk forever.
I know, you're so funny. But first, I mean, like, again, like I said this at the top of the show, like, thank you so much for coming today. I am so blessed that you reached out and like wanted to be a part of this. And for anybody who's watching the shows live, or if you're watching these videos after the fact on YouTube, Twitter, Facebook, LinkedIn, I have put Ashlyn's information, her Instagram handles, in the comments, so you can go and follow her on her personal page or even her professional page. Feel free to ask her questions. Feel free to reach out. If there's any questions that you want to ask Ashlyn next time she comes on, because she's coming back on, we're going to plan it. Make sure you send me a message and let me know. If you want to ask your questions directly, like, let us know. We can always have you come on the show and be able to ask your questions live on the air. And on that note, I mean, first and foremost, thank you to everybody who's been watching and listening every week. I'm kind of a nerd when it comes to numbers, and I get to watch that the numbers are slowly growing every week, which is exciting. We're watching you guys downloading on Spotify and iTunes and all these different areas. If you would like to be a guest on the show, please reach out to me. It's sherryarcuria.com. Would love to have you as a guest. If you have questions, or if you want specific topics to be discussed in future shows, make sure you reach out and let us know too. And Ashlyn, thank you so much again. It's truly been a pleasure.
And thank you so much for having me and having a platform to talk about all this, and hopefully everyone has heard something that kind of helps, and especially around like failure and all that stuff. So thank you so much for, giving me this platform, and this has been super fun. This is super fun.
I'm so glad you're going to come back. And so on that note, I hope you guys all have an amazing week, and we will see you next time.